Welcome to our Vibrant Wellness clinical case study for wheat Zoomer, follow-up wheat Zoomer, and IBS in a celiac patient. I'm Suzanne Barker, part of the Vibrant clinical team, and I will be walking you through this clinical case study. The objectives for this clinical case study are utility of wheat Zoomer and IBS Sure, case review, connecting the dot clinical picture, treatment suggestions, and suggesting next steps and additional testing to consider. For this case, we are looking at a case for a 62-year-old female with a BMI of 17, a celiac diagnosis, who had been on a gluten-free diet for 7 years and also had an IBS diagnosis. The chief complaints of this patient were gas, bloating, diarrhea, fatigue, generalized pain, weight loss, and a stress level reported at a 5 on a scale of 1 to 5. After interviewing the patient reports being on a gluten-free diet for 7 years. She was well educated on gluten-containing foods and was diligent to avoid all gluten-containing foods and products. As part of her gluten-free diet, she consumed quinoa on a daily basis. The patient was a little bit hesitant to do the wheat Zoomer at first because she'd been on a gluten-free diet for so many years and had been so diligent. She didn't understand what it might show her. So these are the results, as you can see on the right-hand side, of the original wheat Zoomer that she did. And she was very, very surprised to see these results. As you can see here, the intestinal permeability was high risk for antizonulin, IgG and IgA, anti-actin, IgG and IgA, and also anti-LPS, IgA. So not only is she having pretty significant intestinal permeability, but it looks like dysbiosis as well. She was high risk on the wheat germ panel, as well as the gliadin panel. You can see she was very, very reactive. On the glutenin panel, as well as the non-gluten wheat panel, you can see she's very reactive here. So this was a surprise to her. So we really did an extensive interview to see where this might be coming from. She was really careful about her toiletries, makeup, all kinds of products, her food. She rarely ate out, and she was very careful to, if she ate any grains, to eat gluten-free grains. One thing that we discovered was that she is eating quinoa on a regular basis. So this was kind of a red flag to me, as maybe it was contaminated with gluten. As she said that she had previously been diagnosed with IBS because she had all of the symptoms. So it was a diagnosis based on symptoms. We did run the IBS Sure test on her, and she did not test positive, as you can see, for antivinculin or the anti-cytolethal distending toxin B. So she did not test positive for IBS by this testing. So for interventions for this patient, we decided that she would do a grain-free diet, eliminating the quinoa from her diet, follow a gut healing protocol. So her protocol consisted of a grain-free diet, L-glutamine supplement, bone broth on a daily basis, probiotics, ginger root, and gluten enzymes. As far as her stress level of 5, we discussed stress-reducing techniques such as exercise, deep breathing, and rest. And then the plan was to retest in 4 months. As this patient is a very compliant patient and really highly motivated to improve her health, she really held to all of these intervention steps. So in 4 months, we went back and retested her on the wheat Zoomer, and you can see the results here on the left. And you can look at the intestinal permeability panel and see how much improvement she had. It's pretty remarkable. She still had a little bit of anti-actin IgG that was really not improved, but everything else was greatly improved, and especially the LPS. So she also reported improvement of every symptom that she had. If you look at the gliadin panel, lots of improvement there. No high risk markers at all, and the wheat germ gluten had completely resolved. The other thing about wheat germ gluten, it does compete with vitamin D for absorption. So just the fact that she was now able to really absorb vitamin D much better is going to also help all of her symptoms. This is the repeat gluten panel, and you can see she had resolution of the low molecular weight, gluten and IgG and IgA. And for the non-gluten wheat panel, you can see it was so reactive over here. Every single one of these was reactive, either high risk or moderate, and she had only 2 in the moderate range. In closing, we can see for this patient that she was able to discover the source of gluten exposure, eliminate it, and heal the gut. And this is pretty remarkable for someone who thought they were so diligent on a gluten-free diet, and she really was to her knowledge. But just that one particular food, the quinoa, which she thought was gluten-free, was really causing a lot of issues for her. She had the resolution of gas, bloating, diarrhea, and gut pain. And she was able to gain 5 pounds. Her BMI went up to 17.5. She reported an increase in energy. And she was also able to reduce her stress, in large part due to the fact that she wasn't constantly worried about her diet. Moving forward, the patient will continue a paleo-type diet and repeat the wheat Zoomer once a year just to make sure that she's staying on track and not getting accidental exposure. So we hope you have enjoyed this case study, and will let us know if you have questions regarding this study. Thank you.